I was thrilled when I first learned about it. So my daughter was here last year, and we were already involved with the therapist that was available down at the clinic for us. So we were already established with her. And then when we found out that it was going to be in school and that she was going to be in here in person, the start of it, that was wonderful. You didn't have to worry about scheduling around after-school activities. I just thought, wow, we're definitely going to have some parents that are going to utilize this, and it is definitely going to be an asset to our community because it was just such a needed thing.
There were clear benefits to you as a parent with reduced running around, reduced scheduling issues, reduced just hassle factor, and benefit of your child getting services that you thought she would benefit from.
It really didn't impact her schedule during the day at all. Once a week for 45 minutes is really not that much. It doesn't really affect anything. She was a little hesitant at first when it came to the telehealth because she had been established with the therapist in person at first. I was like, you're still getting the same benefits because you're still talking to your friend, you're still working on your coping skills, you know, you're still having that time. And so that was a big deal when we went to reestablish for this year because we had, the therapist had moved on to another location. And she is 3 sessions in, loving it, and it's working great for us.
She has been able to establish with a new therapist who is 100% remote. It's working for her, and it is still within the same provider group that she was in locally, so all the paperwork is done, and there's a lot of consistency for you as a parent.
Yes, yes, it was great. We set up the initial appointment during our spring break, so my daughter was with me, and we set up in our living room, and we sat and we talked to the therapist together for 2 hours. It's just so great to see the kid happy about that and the parents really getting involved. You know, to sit down with the therapist, to have that initial visit, because that's so important. All that backstory that you need that parent piece for, and to really hone in what, you know, because even my daughter is almost 13, and sometimes she just doesn't have the words for it. It's just a great collaborative effort. I think it's so good. I wish we could increase it tenfold.